Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd learning experience. The SonarMed Airway monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidien LP, a Medtronic company, for this speaking engagement. For this segment of the series, a discussion on unplanned extubation in the NICU. How are you decreasing the risk of unplanned extubation during kangaroo care? To help answer this question is John Sanford, Respiratory Therapist Clinical Educator at Children's of Illinois.
Those monitors in line, that the parents' anxiety level is a little bit less. They're more apt to participate in kangaroo care if they can kind of keep an eye on that airway. We can go either way. We can either have the parents stand and we transfer them to the parent's chest, and then they have a seat, or they'll be seated in their chair, and the RT and the RN will bring the baby over to mom and place them on the chest. So we're a little bit flexible. We can go either way with those. But like I said, we've got 5 monitors, and we thought we were shooting high at that point, having 5 monitors. We have a very our ventilator strategies are mainly based on non-invasive ventilation. So we don't have too many kids that are usually intubated, we thought. Well, our unit's been very busy lately, and we've quickly outpaced those 5 monitors. So not every intubated kid can have a monitor. But what's encouraging is that we've noticed that caregivers now, the nurses at the bedside or RTs, when they're doing their daily cares or movements, you can watch them because they've kind of molded or morphed their cares to kind of keep a secure airway, if that makes sense. They're kind of changing the way they take care of the babies, because before we didn't think about things. We changed the diaper, we repositioned, and we moved the baby, and our tube looked secure. It looked like it wasn't moving, but we didn't have a really good idea of what it was actually doing inside the patient. So to see them kind of bring how they take care of the babies with the monitor over to the non-monitored babies is super encouraging. So it's kind of exciting to see that we're kind of changing the way we take care of our babies now because of the monitor itself.
Please tune in next week for a new segment from this series, wherever you find your podcasts. This is the Medtronic MedEd learning experience. Thank you for listening.